Pregnant patient during ultrasound. My baby loves Doritos. Me performing the ultrasound on said baby. Oh, baby is opening its mouth. Pregnant patient. OMG, it's Doritos. I just had Doritos. It's eating the Doritos. Working in an ER as a nurse practitioner, I had a patient's granddaughter, who was pregnant, ask me if she dyed her hair, would it also dye her baby's hair? Made my day. They seem to think that by pausing a seizure to inform us that they're having a seizure, they'll get benzos. Lowell, no. I've had male patients in my audiology clinic tell me they have fallopian tube issues. Perhaps I shouldn't assume they mean eustachian tube issues, but I do. A couple was pregnant and didn't understand why, since they were taking the birth control pill. It turns out it was the guy who was taking it. I had a colleague in her 30s with children who had come to the UK after marriage. She asked me one day if you could use tampons before you were married. She honestly had no clue about her own anatomy. I'm in the mental health field, but I met with a client who was worried that if their relative had a heart transplant, would the relative still love and remember them? The logic being that the feeling of love lives in the heart. I can't begin to tell you how many dudes have argued with me that they've had hysterectomies. And I'm like, you mean appendectomy? And they are absolutely adamant that they had a hysterectomy. Pregnant girl who were on the pill, asked why she get pregnant, discovered that one day she takes it, the next day it's her boyfriend, and so on. That's not what we mean by sharing cost. And another one, she pulls the whole box of pills, yes, all 28, in a bottle of water, and take a sip once a day. My dad doesn't have a clue on anything that happens in the body. I told him I work in a tissue lab, and he asked, "Oh, are you developing new Kleenex?" When I told him that I work with body tissue, this man really said, "Oh, I don't think I have that. I just use Kleenex." I had a father of a baby absolutely beside himself because his newborn baby had no teeth. I asked an elderly patient to show me how she gives her insulin. She said, "I need an orange." I said, "Why?" She said, "Well, I draw up my insulin in the syringe, inject it in the orange, and eat it. That's how the doctor showed me to do insulin." Pharmacist here. I had a patient call me and ask me why their medication wasn't working anymore after they had stopped taking it. Baby came out face down. Father freaked out his child was born without a face. We had a good laugh after. Had a mother ask if it was true that the soft spot of her baby's head was like a whale blowhole that he could breathe out of. Apparently, her own mother had told her that. I offered a diabetic a tissue after doing a finger prick to mop the 2 drops of blood on his finger. He looked at me like I was an absolute idiot, said, "You don't know very much, do you?" and sucked the blood off his finger. Then spend the next 5 minutes educating me that because he was a diabetic, he needed all the blood he had. Therefore, he needed to put it back into his body, rather than wasting it by putting it on a tissue. He was under the impression that if he just drank his blood, it would go straight back into circulation. I taught a college-level health ed class, and the misconceptions were truly astonishing. Students wondered why household bleach could not be injected into a vein to cure HIV, and questioned why alcoholics were not immune, since alcohol is an antiseptic. I'm a phlebotomist. I've had so many patents tell me blood is blue until it touches air. Did you have anything this morning for your fasting blood draw? No, just tea with honey and a glass of orange juice. One time I had to explain to a parent that the bump on their child's foot they were worried about was an ankle. Sometimes in pregnancy, women's bellies can gain a little bit of hair, I assume from extra hormones, etc. During a routine prenatal check, a partner asked if it was the fetus's hair poking through her skin. What do you mean I can't eat an entire fruitcake? Isn't fruit supposed to be healthy? Diabetic type 2 with a blood sugar level of 450 milligrams per deciliter. Not a medical professional, but I had a coworker who did not know she had a urethra. She thought that was something only men had. I had to break it to her that she did indeed have a urethra. I'm a dentist, and the thing we get all the time that I hate is parents not caring about their child's decay because they're just baby teeth. Losing baby teeth early causes all sorts of problems, aside from the pain and trauma. But in addition to that, I often have to explain to parents that the adult teeth that erupt at age 6 are meant to last forever. They're always oblivious. I used to take retinal photos to look for diabetic retinopathy. When I would call to make appointments, more than once a patient said, "Well, I just saw the proctologist." No, sir, these are retinal photos, not rectal photos. Holistic doctors have convinced a lot of people that adding bleach to their drinking water will cure chronic diseases. Literally a high enough dosage to stain clothing being drank through a straw. Best part is there's no convincing them otherwise. I had breast reduction surgery. My husband went to the pre-op appointment with me. The doctor was explaining the surgery and mentioned they would remove my nipples. My husband asked where they were going to get new ones from. 12 years later, and we joke about wondering where the nipple locker is. I'm not a doctor, but my sister works in a hospital. No, you don't need to go to the ER for a paper cut. You won't bleed out. That the only reason to eat healthy is to manage weight. Also that alcohol is not harmful unless you are a full-on alcoholic. How are you feeling today? Not great. I have a cough that starts from an emotion in my throat and chest. That emotion disturbs me. A bacterial pneumonia. Roommate is a neighborhood spiritual guru. In the ER, 4 a.m., teenage girl and her parents arrive. She's been constipated for days, and no poop has come out at all. I was busy, so I asked the nurse to check if the patient indeed has poop and needs an enema. So a rectal exam is needed. A few minutes later, the nurse urgently called me. When we uncovered the girl, she had tons of clothes. We just saw this cute little head popping out. A baby on the way. Why didn't you tell us that you were pregnant? I asked. I'm not pregnant, she kept saying while I was cutting the umbilical cord. She lied to her parents. Don't know how to this day, the whole pregnancy. She lived with them. I had to explain everything to the parents. They didn't have a clue, and judging by their face, I believed them. Do you have any medical problems? No. So no diabetes? No diabetes. What medications are you taking? Metformin. For my diabetes. I facepalm every time. I fell down onto my couch and a cucumber was sticking up between the cushions. It went right in. Had a patient show up the ER with a wound to the back of her head. I say, "Hey, Miss X, what happened?" "I don't know. I picked up chicken from the gas station and went to bed. And this morning I noticed I was bleeding." I start inspecting the wound. Looks like it tracks pretty far, and there's this strange cotton-like material sticking out that is also tracking too deep to visualize. I press her some more about the circumstances because my ER doc's spider sense starts going off. Me. Were you assaulted? Did someone harm you? Were you in a car accident? Did something fall on you? Patient. No, I just went to bed. Maybe I got up in the middle of the night to use the bathroom. Finally, I decide to send her through the donut of truth, aka get a CT scan, of her head before me, and my trusty scalpel starts seeing where this trail of mystery cotton leads. The lady had a bullet lodged up against her skull bone. Still don't have an answer to the cotton, but I'm guessing the gun fired through some cloth. When I told her she had a bullet in her head, her response was, "Oh, weird." And then she went back to playing Candy Crush on her phone. Woman comes to emerge with complaints of vaginal discharge and discomfort. Pelvic exam initially reveals significant yeast infection, but there appears to be a foreign body in her vagina. Is there something stuck inside? No, I don't know what's in there. Speculum examination reveals a very soft mandarin orange, peel still on. Oh, that! We heard it would improve our fertility. You can't make this Siat up. One dude lied about being paralyzed after a lumbar puncture. Get a call from nurse patient says he can't move legs following a lumbar puncture, spinal tap. I called the team that did the procedure and they assured me there was no indication of this sort of injury happening during the procedure, but agreed with my plan to get an urgent MRI. I go to examine him and nurse says she thinks he moved one of his feet. Next thing I know, he says he can actually move his legs again, but they are feeling weird. Then this weird feeling turns into intense pain, and he asks for intravenous narcotics. Dilaudid. I tell him no because this story makes no sense. By God, it was a miracle, I tell you, when this man walked himself right out of the hospital after I refused the IV narcotics. Also, the MRI was normal. I haven't had sex in 5 years. Woman who was actively in labor in the ED. Once I asked a patient if he had done any surgeries in the past, and he said no. When we did a CT abdomen, he had 1 kidney and signs of scarring, so I went back to ask what happened to the kidney. He said he has no idea and started winking at me and sweating. I took the hint and came back later when he was alone. Turns out he sold his kidney because he lost a lot of money gambling. Honestly, the dumbest lies are the one people who lie about how much alcohol or other drugs they use. Alcohol and benzodiazepine withdrawal can kill you, and if you use opioids from the street, then you likely have a higher tolerance and may need more medications in the hospital, so be honest. I truly don't care how much you drink, use. I just don't want you to get worse for something we can plan for and prevent. When I was a PEDS nurse, I had a super trashy lady come in with a 2-year-old. She said the baby wasn't eating or drinking anything. We admit the baby and legitimately start getting concerned because the food trays aren't touched, no wet diapers, not drinking her juice, etc. Way is staying the same, though. The pediatrician asked me to sit outside the room and watch through a cracked window shade. That looked into the room. So I watch, and this mother is shoving pizza and soda down this baby's throat. The baby obviously has no interest for the mashed potatoes chicken on her tray because she's stuffed on junk food. The mom would change the diaper and hide it instead of leaving it to be weighed. It was so bizarre, and she completely denied doing it even though I saw her. Poor baby. Nurse here. The absolute dumbest thing patients have said, and to be fair, this was the patient's parents, since I was in PD but still dumb AF, and caused no end of grief trying to unspin it. I was rooming patients, and I went to the full lobby and called the next one in by last name. They stand up and mom and dad bring the little girl back. I'm rooming them, take the vitals, review purpose of visit, make some adjustments to the chart, update their pharmacy and allergies, and go out and let the pediatrician know they are ready. The pediatrician goes into the room and come out like 3 minutes later and says, "That's not my patient. Where is my patient?" I'm like, WTF? I go in and ask the parents, and no, in fact, they were not the patient. I'm like, why did you say you were someone you were not? They simply said they didn't want to wait, so they just came back. We had to completely unspin all the changes to the chart and had to get legal involved to make sure there were no HIPAA violations, which fortunately there weren't. I'm fascinated that people can collectively think, yeah, let's do this, no one will know. Like, how does that even play out in their minds?